just got fixed up by the staff here in the medical room. And you know, our athletes are out there working hard, competing hard every day. There's obviously some wear and tear in their bodies, so it's the folks here in this office who keep them going.
Our typical medical clinic is set up just like any other acute care. We call it kind of the field medicine. So we don't have all the technology, but we have the accessibility of technology and all the care through the VA hospital. We have one in a hotel where most of the veterans are staying, and we also have one in convention center where there is a majority of the activities are happening as well. Typical setup is we want to be able to take care of 3-4 patients at a time, and then it's manned usually by 2 or 1 physician and two nurses. Our typical layout is like an acute care where a patient comes in, a nurse triage, and then the physicians are called in to take a look at it. Typically, we have 2 nurses per venue that's out there in the activities, and usually 1 or 2 physicians at the venue that I determine that it's a high-risk area. So in some of the high risk that I determine are high temperature, high crowd, high impact type of sports. And it's a low-risk area. We have typically nurses that are comfortable taking care of patients on their own with us being on call. So our staff in general are 7 physicians and about 40 or 50 nurses that will cover the entire week. This year, some of our doctorate PhD types always do research here. Every year they do great researches here. Dr. Rory Cooper, at least 2 or 3 research are done out of here, and produces great papers and literature for many of the scientific community. I myself completed one this year as well, and our preliminary results show 50% of our veterans mark that they actually, the sport, the National Veterans Wheelchair Game, has actually inspired them to go out and get a job. That's huge. Tons of studies have shown that any type of sports activities, recreation activities such as these, especially when it involves competition, have shown great wellness in a person's, just physical as well as mental. That's been in any literature from many years down, and probably in the future too, you know. And if we neglect that kind of data or that kind of evidence, I think we're doing injustice to our veterans and probably non-veterans as well. There are so many reasons why we need to continue on with something like this.
The 35th National Veterans Wheelchair Games, co-presented by Paralyzed Veterans of America and the Department of Veterans Affairs.